Hello and welcome back to the Dandy Soap Herb Shop. I'm Elizabeth and I am currently fighting inflammatory breast cancer, stage 3, with invasive ductal carcinoma. And the reason for this video today is I took my fourth cycle of the Red Devil that will be the final of the stage 1 of chemotherapy. And so there'll be 2 weeks and then I will begin Taxol that will be every week, and that will be the second stage of chemotherapy. And the idea with that is the tumor has changed dramatically. So let me explain. That's the reason why I wanted to make this video, because I got chemo today, so you can tell that I'm a little tired, and you know things are taking place, but you're important to me, and I know that right now you're needing answers, and I really want to share as much as I can with you. So while energy is up a little, and I'm able to before, well, over the next 9 days, I'll just be like a limp dish rag. I'll have bouts and struggles, and it will start affecting my peripheral nerve system, which is your motor skills. Um, you know, eye sensitivity, hearing, taste, being able to talk, shaping letters, keeping eyes open. These things are your peripheral nervous system. They run off your peripheral nervous system. So they're your motor skills and they're your reactions. And so things will be delayed or might be sluggish to pull together a complete thought, things like that. And so I'm really potent it right now, just having that chemo treatment. This is the fourth one, cycle 4, and remember it's a cumulative. So each time you take one, your fatigue is going to be very, and it may take you that much longer to overcome it. But I had already begun adapting. Like my body was already. I got into a routine or kind of knew what to expect, and so that'll happen with you too. And you'll be able to know your limitations and pretty much when you might be able to be a little more energetic and you know talkative and able to keep your thoughts together. um, and I want to also talk to you. There's two things on my agenda today that I want to share with you. So let's talk about um, when you go in and talking to your oncologist prior to your chemo treatment. So what happens there is a lot of times they have what they call catheter care. Now, catheter care is when a registered nurse licensed in special in oncology will come in and she will go ahead and cleanse your catheter. In other words, she'll have a syringe with a pigtail on it. It will plug into this and she'll screw on the syringe and it will have a saline solution in it, and that will make sure that there's no dry blood or anything trapping the ductwork per se, and cleanse that and pull that out. After that, she will draw 2 to 3 tubes of blood. These are your panels and comprehensive, and even your metamorphosis panel that will be sent down to the lab. I happen to be in a facility where they have a lab on site, so those are sent right then. Now, the reason why they're going right then is the next person that enter that room is going to be your oncologist and or PA, and they are going to come in a little bit later. So those are the first thing they send out of there is do that, because they're prepping the catheter, your port, to take chemotherapy, and they've drawn the blood, they've cleansed it and everything. They've prepped up this site. They have masked it. You've had to wear a mask, and they've masked this and closed it so it's secure and safe, and making sure everything's flowing right to ensure that none of the chemotherapy can seep out of this or get on you or harm anyone or yourself. And of course, keeping it very sanitary. No air, oxygen, or nothing. It's just going to keep all that to a mask over top of that with the pigtail coming out of it, and it closes around this adhesive. And that will stay on there the whole time you're receiving treatment. Once your treatment is complete, they will gently remove that and then take the pin out and they'll put a band-aid on it. And so it'll just be a little round band-aid, and that has to stay on there 12 hours. So, things to bear in mind. If you have not bathed, make sure you take a bath on the day you go get your chemo treatment, or at least the day before, because you can't get this wet for 12 hours. And pretty much you need to grab that window when you can, because you're going to be too tired. Your fatigue is going to kick in. You're probably going to fight with nausea, sickness on your stomach, and, well, yeah, you're just not in a good way, and you're not going to be up to taking no shower or taking a bath. So go ahead and do that the night before or the day of your chemo treatment prior to going to treatment. This way, you feel like you can handle being taking care of yourself for the next 2 to 3 days, and catch those windows when you have the energy, because you do want to continue to move every day. All right, so the thing I want to share with you on this, and I know I've used time like telling you that, but I think you'll enjoy the information. uh, you're going to meet with your oncologist. Now, at this point, when the oncologist comes in, they're waiting around for those lab results too. And they're going to go ahead and the nurse will have had you to derobe and place a cotton robe on, and, remove your shirt and bra, so that the oncologist, your doctor, can examine your breast. And they're going to do a thorough examination. They are looking for changes in the size of the tumor. If anything new has developed, they're looking at the skin, the suppleness. They're, examining it. They, of course, going to have your arm up. They're going to have their examination chair. And you, like me, I'm a little older, so I may have to roll over a little bit so that they can get closer to the ribs and examining that breast. So these are things to expect when every single visit. So the most exciting news for me, and I am praying that this will also be exciting news for you. Perhaps you're in the same boat as me, and you've taken 4 of the chemotherapy treatments, you've taken the Rubinson and the Cytoxin, which is a layered chemo. They put in one and then the next one follows. Very strong and powerful. And this is my 4th one. And in that period of time, my tumor changed shapes from day one. Like the very first chemo treatment, it changed shapes, almost like it melted. And then over that time, it has gotten more and more different. My breast feels like it did once again. It feels normal, and you can still feel that firm tumor, that hard lump in there now, but it's a different shape. It's definitely smaller, and that is great news, because my tumor was 57 millimeters, or 5.9 centimeters. It's very large. And then the other part of it was almost 3 centimeters, which I think would be like 30 millimeters, maybe bigger. I'd have to do the math on it. For those of you who do, they do it in uh, cm, and they do it in centimeters and millimeters, and it's, like the UK does like millimeters, the US does centimeters. So just FYI, just do the conversion table if you want to convert it into inches, which is what I do. And then the other side was also almost around 2.9 centimeters, and then the thickness of it. So very large. It was basically the size of a hockey puck. Just to give you an idea, that's how large my tumor was. And the great news that I want to share in addition to that is there is a predictor tool. So in the predictor tool, there's one in the US and there's one in the UK, and I'll be sure to use that link in the description box so you can go there and check it out. And you can plug in certain factors because if you're on the same pathway as me, they're intended on issuing me a pill to inhibit the estrogen, which is what feeds my cancer, because I am uh, estrogen and progesterone positive, and hers too negative. So hers too is, negative, and um, generally with invasive ductal carcinoma alone, they don't treat you with chemotherapy as they have me. That's really not the route that they generally commonly treat that tumor. And unless they have changed things with the size of the tumor, and then they do it. But the inflammatory breast cancer has been their real big concern, their focus and concern. And because, like I told you in a previous video, when you're dealing with inflammatory breast cancer, that means that the cancer is in the fatty tissue and the skin. So it's eating inward and outward, and that can, spread. So they're going to go at it with everything in the kitchen sink. I mean, they're going to throw everything at it, and I mean, super strong, hard, and fast. Um, so the good news is that when I met with her, and she too was very tickled and surprised and impressed with the size of my tumor. And we are talking about that second layer of chemo, that stage 2 of chemo, using the Taxol. And I've expressed to you in previous videos my fear of that because it affects your nerves. It can cause neuropathy, and you can lose nerve feelings and prickly needles, not even be able to button your shirt with your fingertips, fingers, and your feet and toes. So that just petrifies me. That's just the scariest thing to me because, well, I'm an herbalist and I make things and tedious measurements, and I'm also an avid crafter. I repair vintage quilts. I make quilts. I'm a seamstress. Um, I'm a licensed cosmetologist. I really, truly, everything depends on my ability with my hands. Um, I can't just use a keyboard and be done with it because I do that too. I need to be able to sew and cut and do things, and uh, prickly needles and stinging and stuff, neuropathy, if you've ever experienced it, it's very painful. And I'm praying that, you know, that doesn't happen to me, that I might be an exception to the rule. I'm going to do everything. I'm going to use the cold mitts. I'm going to use the cold feet packs. My husband and I will freeze them, and Michael will put them in a cooler and take them to the facility. And when it's ready, I have to start wearing them 15 minutes prior to the treatment. Here is the good news in talking to her. This is why it's so important to listen and also be proactive in your care. So, come to find out, she also uses the same predict tool for determining estrogen and the possibilities and potential, how it can benefit you or not. And she used the same tool as me, even though they got one US. She said they had took it down for a while and were doing some things, but she was just easily able to access that one, so she uses it. And they do communicate a lot. America and UK, they're very tight when it comes to anything regarding saving lives in cancer, especially breast cancer, because they're making innovations and so are we. Now, in this conversation, the reason why I'm telling you this, I'm telling you two things here, okay, rather than making two separate videos. The excitement is that with this progress, and mine is done so well, it may be that I only have to take a few, just a limited amount of the Taxol, and it shrinks the tumor enough that they go ahead and set me up to do some imaging and check out and see what this thing is looking like, and that could hasten and speed up me going ahead and having surgery to remove the tumor. So, yeah, I don't want to get my hopes up and then just be disappointed, but it's so exciting. It's so exciting to hear that from your oncologist and to know that they're thinking like you, and to know that they do want to try and avoid exposing you to the poisonous chemicals of chemo as much as possible. To get to that base, to get to where they need to get you fixed, without your body being punished and go through that, because they are very well aware of all the side effects, future side effects, and things that come up when chemotherapy is used as part of the treatment. In addition to that, her using that same predict tool that I'm going to share with you under, in this video, and check the description box for it, and you'll be able to go to that website, have your information about your diagnosis, the size of the tumor, all these different questions, and your age. You'll know all this stuff. They're easy questions. You'll know the answers to, and you just fill in those blanks, and it tells you like John, like right there on the spot. And I use the one that shows the index, and which is like these little circles. Uh, I like using that, but you have 5 options. You can click on all of them, and it'll break it down for you. But it would tell you, what is that a good idea? Would you benefit from it? Is it, like, is it going to be the same with or without you taking an inhibitor? Um, it will give you clarification on if, because you may be like me, I really do not want to have to take any kind of inhibitor for estrogen, for mainly because I'm already went through menopause. I'm 10 years out. I'm in postmenopause. I started menopause at age 48. I'm 58 now. I've done, for the past 10 years, done dealt with that. And, been finding this late. So if, if it's not going to improve my mortality, uh, doesn't change, and it doesn't improve my ability to live longer and improve my longevity and mortality rate to drop, but and versus go up, then it'd be pointless for me to take that pill, in my opinion. And remember, they're on your side, so they're not against these things and this information that you're sharing with them. Also, another caveat that she shared with me, and I'm going to share it with you because you're watching this video. So if you've gotten this far into the video, here is another thing. Here in the U.S., like right now, she is aware that they have come out with a medication, or medications rather, that I might be able to trial test, all right? Might get approval for trial tests that simply focus on killing the cancer by the capsule and not blocking estrogen. Just allowing your body to go through its natural changes, but the pill targets cancer cells. So there are medications that they are talking about that basically hunt down the cancer cells and keep them dead and dormant, um, or inactive and dormant, and do not affect your estrogen. So that is exciting that she shared that with me, and which makes me feel good, because I think she may be because I am doing trial medications already, and I was totally on board with it. As soon as she mentioned it, I'm like, yes, yes. Um, and so she already knows that I would be an individual who would be on board with that. The fact that I'm very proactive, the fact that I don't want to put anything in my body that's going to cause harm, that I am doing things to help myself, and I'm very involved. Um, and that makes me feel good, because my oncologist sees me as a person, and not her being a more intelligent mind that I can't comprehend. She really is on puts you on the same level. She don't talk above you or over you. She is very including. Uh, she's so she has such a gentle disposition about her. I'm very fortunate, I feel, to have been somehow put with her. And I'll be honest with you, I have been so lucky because in all, as large as our area is, we have one of the top rated hospitals, learning centers, and cancer centers in the United States. It is like up there in the tops. And um, dealing with Wake Forest Baptist uh, Medical Center and Atrium Breast Center. Also, we are Brenner's Children's Hospital with a first cancer center for children. So we are very, very advanced in our technology and our studies, and we um, collaborate with others in the same field. So there's just about everything available there. And they really truly do have a meeting of the minds and decide what's going to be the best for you. So with that being said, I am fortunate that I got put together with the top doctors and the top surgeon in the breast cancer field available to me. That is amazing. So God knows what he's doing, because I have the very top surgeon that you can even get when it comes to breast cancer. Top oncologist surgeon in the field. She is also the director of the entire breast clinic, the entire breast center for Wake Forest Baptist Atrium Health. Um, that is Baptist Hospital, some of you may know. If you're local in North Carolina, we still call it Baptist. They still call it Baptist as well. And they call it Wake Forest Baptist Hospital. It used to be Bowling Green School of Medicine. And those things are like, that's amazing. My oncologist, she is the very top in her field. She is constantly studying cancer and looking into different methods that can be beneficial to assist her cancer patients with their side effects, their sicknesses, symptoms, and anything to ease their pain and ease the whole ordeal of taking chemotherapy. So there are so many wonderful, exciting things. So I had good news today, and that was exciting to me to know that there is hope that I may not have to take all of those treatments. Uh, but, and that I would be sent for imaging just to see what's going on there and kind of get a general idea of the size of it and what it's doing. And so those will come. I'm sure we'll figure that out after a couple of treatments. Number one, uh, need to really truly see how well I'm going to tolerate the treatment, um, and if I will do as well with it as I have with this one. In her opinion, she says that most people do better with the Taxol than they did the Red Devil. Well, that kind of worries me, because according to them, they are impressed with how well I did with Red Devil. Like, a lot of people do not do well with it at all, and they were just blown away of how well I've dealt with it and how well I've done with it. But let me offer you some things that you may want to consider that I did. And I'm adding it onto this video because it applies. The reason why I think I did well. The reason why I think I uh, adjusted well. I mean, don't get me wrong. I wasn't out of the ball. It didn't take me out of the hole dealing with it. But it did make things easier for me. See, when they issued me prescription medication, I'm hard studying. First thing I'm going to do is I'm going to check those medications out. I want to know everything about them. And first, I tell you right now, I am always been against steroids. They literally just push down a bacteria, a fungus, an infection, a sickness. They just push it down. They do not kill it. They don't eliminate it. It does not rectify it. It simply just pumps up your body to supposedly your body's immune system will kick the bacteria, fungus, sicknesses ass. And you have to understand they're feeding these steroids to people, everybody. Now, you have to remember steroids are illegal for an athlete, someone who's bodybuilding, someone who's an athlete to use. But yet this is what they ought to give you if you have a flu, if you have pneumonia, if you have bronchitis, if you have a sinus infection. Are you kidding me? Really? So I got sick because my immune system was down, and your dumb bunny butt thinks issuing me a steroid is going to pump me up so that my immune system will suddenly go, oh, well, let me just kick its ass. Y'all, when you're taking 2 and 3 batteries of antibiotics, I mean, not antibiotics, excuse me, when you're taking 2 and 3 batteries of steroids, that ought to be the first sign right there. That if it didn't work the first time, what makes you think the second and third round is going to help you? If you're going to do that, just look to your food. Just get an herbalist and say, hey, what can I do to make me feel better to get over the sickness? And if you have pneumonia, you better take your butt to the emergency room and do not dick around no darn steroid being issued to you. Go to the hospital. I tell you right now what they're going to do to you. They're going to hit some fluids to you, and they're going to pump some antibiotics in you right away. Because if they don't, you could die. Your lungs will fill up with fluid. You would drown in your own body fluid. Why would you want to do that? Why? And you can't breathe because everything's inflamed. It's so blowed up, and your chest is tight, and everything's hurting. You're under pressure, like your body's literally under pressure. Imagine being compressed in the ocean, just like you can't breathe. It just makes sense of it. So they issue me a steroid. Well, I do not want nothing to do with that steroid. But guess what? They pump the pre-meds into you prior to your chemo treatment so you can tolerate it. Steroids is one of them. Totally get that. No problem. Fine. Pump it in me. Because that's what's keeping me up right now, guys. That's really what's got me jacked up. That's why I'm sitting here talking to you, and you can clearly understand everything I'm saying, and everything is moving. Because that will have my system jacked up to a point, for at least 24 hours. And sometimes it'll last a little bit long, but most of the time it just lasts 24 hours from the time you took it to that 24 hours on. That is why generally tomorrow when I have to go to get my growth injection shot, I literally have to hold on somebody. I'm taking the Zofran they issued to me, which is also a pre-med that they pump into you, for the nausea. And then they have a secondary nausea medication that if your nausea is so bad, to take it that actually will make you sleepy. You can do these things in recession. They'll tell you how much steroid and how often, how much of the nausea medicine and how often, and then the other one that might make you drowsy, you cannot operate equipment, how much of it and how often. So there's just a triple layer trying to keep you from throwing up, keep you combating the nausea so you would eat. Because keeping your food consumption and hydration of water and liquids in your body, whether it be juice, coffee, tea, whatever, in your body will help your body to overcome the effects of the chemotherapy. Now, in the first 48 to 72 hours, when you urinate, you're going to be urinating chemo out of your body. So you want to stay diluted with keeping your body full of fluids, like hydrating it, so that does not sit in your kidneys and bladder and cause damage. You want to go ahead and keep that diluted so you urinate it out very quickly, because the chemo's done run through there. It's going to keep working. Trust me, everything's going to deposit. It's accumulative. It's going to go everywhere through your entire body. Everywhere blood runs, chemo is gone. Head to toe, in and out, all over. So just be aware, keep your fluids up and urinate out the chemo. The first urination that I have directly after receiving my chemo, it is like orange red. My second one is a little bit duller, and then my third one will have almost like a deep yellow, and so you can tell that it's getting weaker of it going out of me. And make sure to disinfect your commode with wipes. Use disinfectant wipes. cleanse the lid. Make sure you close the lid when you flush it, and then when you finish, when you that finishes, open it up and make sure you wash it down with the disinfectant wipe and dispose of those. Wash your hands, and then that way you keep the area clean for others who may be using the restroom behind you. I know clean the commode every time you use it, right? Don't worry about the internal bowl. I'm talking about the lid where you have sit down and your secretions have potentially splashed on it without you even knowing. It could be the smallest amount. I mean, we all, females, it just does that, okay? You have a stream, but it splashes. So just don't overthink it and just do it and be done. Um, so just bear safety in mind. Safety for you, safety for others, to keep them from being exposed to your chemo. When you're going through treatments and so forth, uh, like I said, you will be really tired, and there's it's important to move. Okay, so even though you're fatigued, be careful. Hold on to something. Make sure you got a good footing. Getting yourself from the couch or chair to the bathroom or bed to the bathroom. And if you really need assistance, don't be ashamed or bother to ask someone to just kind of be your little guardrail. Just kind of, be there in case you do need someone, or even usher you to the bathroom. And then that way they can also help usher you out if your strength is really, really down. Like I said, the more treatments you have, the more fatigue and it comes on. So what I was telling you about the medications, what I think would help you, I opt not to take the steroid or the nausea medication that makes you sleepy, that puts you to sleep in the extended days after my chemo. I figure the less crap that I put in my body, the better I'm going to feel, and the easier it will be for me to overcome it. Now, that does mean that I have to kind of suffer that fatigue, because steroids will pump you up. It's kind of a layered reason that they give you the steroid. Number one, gives you energy, helps fight the fatigue. It fights nausea and can guard against you throwing up. So the steroid is like a triple layer type pill that you're giving you. Then the Zofran, you can take that every 8 hours. It may be 6 hours, and that's definitely going to fight nausea and build up of stomach acids in the stomach. So make sure you're eating something with some weight in it. Now, a lot of diets say stay away from bread, stay away from crackers, but the truth is, if you treat this as though you were a pregnant woman, eat crackers, eat peanut butter crackers, eat nabs, um, eat toast, anything that is dough that will swell up and put weight in your stomach. Pinto beans, which will give you gas, but the other thing that I have to fight with is constipation. So I'm trying to think, okay, what can I eat that will keep me from getting constipated, help me move my bowels, to hydrate my body and keep weight in my stomach. So you're like doing all this thinking. And so just some easy things that I can name for you. You can do some steel cut oatmeal and let it soak overnight. Call them overnight oats. You can do the rolled oats, but remember the processing they've done is going to deteriorate some of the fiber. And if you are fighting blood sugar and keep an eye on it, well, those things you got to be mindful of. Maybe eat a boiled egg before you eat the oatmeal. Uh, Pancakes. Now I know these are all breaded things, but those things will put weight in your stomach. They will make you feel better. They will help you fight getting sick. Now, if you do like me and you don't take those additional medications after you've been administered those on the day of your chemo, these are things I'm offering you that I do that help me fight the nausea, and then I just have to deal with the fatigue. There are sometimes that nausea, it doesn't matter what you do, you may have to struggle with it for several hours. But once it calms down, which is usually in the first 48 to 72 hours, if you can just take out your Zofran, which is what they have me on, and keep something doughy, eating it, and make sure you do plenty of broth, that'll help too. Protein drinks I have not become a fan of. I do have them, but I haven't become a fan of taking them. I'm sure that time will come because I'll be so nauseous. It's just a matter of getting something in me that will sustain my body. Um, so that's another option. They're still a good thing if you just don't feel like eating. Drink your protein drink. Keep your electrolytes up. So if you're a Gatorade or Powerade or I'm trying to think of the other one, Body Armor. Uh, Body Armor is highly recommended by the nurses. Some of the nurses really tell you to use it because of less sugars and stuff. But whatever makes you feel better. Ginger ale, Sprite. I know it's caffeine drinks and they are sugar, but you gotta you got to look after your stomach first. It's priority because you will not be able to function. You will not be able to just tolerate it. It's just horrible. You want to get that nausea taken care of immediately. And for me, I'm old school, so if it is really bothering me, I will get my Pepto-Bismol out and I will take a shot of it, and that usually will just quill it out. The rest of it is history. I won't even deal with it because once I quill that nausea, I'm going to get hungry. Now my body's going to identify the hunger, and it's the growling and so forth. So these are just some things that I do and why I decided to go that way. And I'll tell you, I think that it's paid off. I've had to deal with massive chronic fatigue and nausea anyway, so I could take those meds and wavered from that. But you know what? 48 to 72 hours, it's not a problem anymore. Now, the fatigue is, but I've dealt with it too. Just stay in motion. If you can walk around 10, 15 minutes, yard, pace the porch, walk around the house, do laps, whatever. This is not a marathon. You're not trying to run, okay? You're not trying to get steps in. You are keeping your body upright and in a walking motion. That's the idea. It doesn't have to be fast. Just one foot in front of the other. But try to stay active around 10 minutes, and maybe the next time 12 minutes, and maybe the next time 15 minutes. And then by then, you just need 15 more minutes. So the goal is an hour a day if you can stay active. If you're not up to it, do not worry about it. Rest. Do what's best for you. But I will tell you, when you're feeling that like your motor skills don't want to work and anything, if you can, make yourself get up. And this sounds crazy, but it's true. If you can convince your body to get in motion, even if it's just for a bathroom run, you'll notice that you actually feel better and that you're able to kind of overcome some of that fatigue, and it'll wear off faster. It really will. It'll wear off faster. It'll come in waves, and then it'll wave out. On these first days though, when you're chronically fatigued, it can take 7 to 8 hours for that to waver, and it don't matter that you went to the bathroom and back. It ain't gonna pass. But once it waves, you'll get a good window there, maybe a 1.5, even 3 hours that you have some energy. Now, that doesn't mean you can get up and run around. It just means that you're going to be alert. You're able to interact, conversate, maybe return phone calls or text messages. Usually I text message because I'm still having trouble making letters. And then by the time you get to your 7th day, 8th day, 9th day, now you're kind of gotten used to it and adjusted. And when you hit that 9th day, then you're going to get maybe 5 days of just feeling good, great energy. Unless your chemotherapy comes every 3 weeks. Mine is every 2 weeks on this first stage of the chemo. So I just took my last of that. So you'll figure it out and you'll feel better. I hope that this has helped you and can assist you in your journey and remember what I told you. If you just want somebody to talk to and you are going through IBC, um, if you're no matter what stage that is, and it's I'm here for you, and be sure to reach out to me. So uh, ask me any questions, bounce ideas, whatever. I will leave my website below because when you go to my website, you see my phone number and email address. It just makes it safer, and I just figure if you take the time to go over there, you're sincere and you're not trying to pull the wool over my eyes. So I do share my website below. You can always leave a comment, and I will respond to your comment in the comment box underneath this video. I appreciate your likes. Subscribe for future videos and as I go through my journey with my breast cancer, inflammatory breast cancer, and invasive ductal carcinoma. And subscribe to receive notification of each and new video I put up. Until the next one, this is Elizabeth.